Okay, there are three things that need to be considered with regard to laboratory culture of methicillin or multi-drug resistant staphylococci. Firstly, MRSA and MRSP have very different zoonotic implications. For multi-drug resistant staphylococci, it is therefore very important to differentiate between Staphylococcus aureus or MRSA and Staphylococcus pseudointermedius or MRSP. You need to check with your lab that they are confident in differentiating the two Staphylococcus species. And additional phenotypic tests are usually sufficient to make a good prediction on the species, and genetic confirmation should only be required in unusual cases or for research purposes. The second thing is, if you're suspecting only low numbers of bacteria, for example, when you're sampling after clinical signs have improved or resolved, you should ask the lab for specific enrichment culture for multi-drug resistant or methicillin resistant staphylococci. This will add another 24 hours to the analysis, but it will increase sensitivity and therefore the ability to increase the ability to detect methicillin resistant staphylococci and reduce the risk of stopping treatment too soon. And lastly, in cases of MRSP infection, where systemic therapy is required, but no licensed products have been shown to be susceptible in vitro, you can ask the lab to do extended susceptibility testing. And the use of less frequently used or off-licensed drugs should always be discussed with expert colleagues who have got experience using those drugs.